This episode of Ask the Doctors has been brought to you by Wayne County Government.
I wear my mask to keep my family and friends safe. I think it's important to wash your hands because it wipes off the germs. When I play with my friends, we stay 6 feet apart. Keep wearing our masks so we can stay in school. I wear my mask so people don't get sick. I think it's good to wear your mask because it encourages other people to wear their mask.
Good afternoon. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, and we're streaming on Facebook. Thanks to John Pawsey and his staff at TV3 in Connersville for airing this show as well. If you have questions, you can, of course, ask them on WCTV's Facebook page, and you can also send them to Twitter at WCTV Info. I'm Jason Troutwine, Vice Chancellor for External Affairs at Indiana University East. It's a pleasure to be here today, stepping in for Eric Marsh, who couldn't join us. And of course, I'm joined by the doctors today. So Dr. Tom Huth, the Vice President for Medical Affairs at Reed Health, and Dr. David Jetmore, the Wayne County Health Officer. So gentlemen, thanks for being here again today.
Wow, thank you for being here today.
Always a pleasure.
My pleasure too, thank you. Dr. Huth, we'll start with you. Big transition this week, moving everything to the Coleman Center for vaccines.
Yes.
How's it going?
Very well. I think we had a super big first day, did over 700 vaccinations the first day. Not quite so many since then each day, but we're expecting that to pick up. And I think the goals that we were trying to achieve for that are certainly be realized, which is we don't want any of our own resource constraints to be the limiting step. Right now, the only limiting factor in us being able to crank out lots and lots of vaccine is the state being able to supply that. So we're pretty happy with where we're at.
And the supply seems to be pretty steady right now?
Well, there are some storm clouds on the horizon from the vaccine supply perspective. Okay. It's a great example of how things changed in a short period of time. A week ago, 2 weeks ago, 3 weeks ago, we were being actively encouraged to expand our capabilities. If they're telling us, if you can expand your vaccine capability, we will send you more vaccine and make sure that you can do that. But things have shifted, and I think it's part of a big fabric of things. Some people may recall that prior to the presidential transition, then President-elect Biden's office were saying they need to release all these vaccines that are being held back. And I think that was news to me. I didn't know they were holding vaccine back. And so Operation Warp Speed said, okay, we'll release everything that's there. Well, it turns out it wasn't very much. And so a lot of hopes had been built up that there was going to be kind of a glut of vaccine. And I think that's what informed the state's prompting of us to look at expanding our capabilities. And that has not transpired. In addition to that, Pfizer to some degree, but Moderna to a larger degree, are having manufacturing problems. And so they're not keeping up with the estimates of their supply capabilities. And in addition to that, the Johnson & Johnson vaccine, which really a lot of people are really looking forward to because not only does it not need the ultra-cold storage, it's one shot. That may go to the FDA this week or next week for approval. We haven't seen any data, I haven't, on the effectiveness, so we'll have to see how that works. But they're saying that they are also having manufacturing problems, and so even if they do get approval, they're not going to be able to supply large amounts for a period of time. All of that is informing a lot of things that I see happening. For instance, the CDC, very fascinating to me over the course of the last 3 weeks, have been kind of slowly shifting the wording of the guidance on vaccine intervals and the like. So, for instance, back in the beginning, it was with Pfizer, you should get vaccinated on day 21. Maybe a little bit around that date, but not very much wiggle room. With Moderna, 28 days, exactly. But, then it had shifted to, well, don't go very much ahead of time, but maybe you can go out a little bit longer, it's okay. But very indefinite about how much longer. Just yesterday or today, the CDC's updated its guidance that it's okay to give either one as long as 6 weeks out from the first dose. Not preferred. We still like you to get it 21, 28 days, but it's still a valid second dose if you have to go as long as 6 weeks out. So the point I'm trying to make is there has been a subtle shifting of these timeframes and goalposts that, to me, when you get to, we're now being told that we cannot expand our vaccine, and we should, and we may have to watch our vaccine supplies closely so that we can get second shots in. They're not guaranteeing that the original delivery estimates are going to be met, and this subtle shifting of lengthening the time frames that where we still have a quote-unquote valid second dose. To me, it's all consistent with the stage is being set for more pervasive supply problems, so that maybe people aren't going to be able to get their second doses in the time frames. And in addition to that, CDC also has now actually said that you should get the same product that you had on your first dose, but in extraordinary circumstances, if you have to substitute the other, it'll all work out. So I think, to me, all of this indicates that we're on the brink of perhaps serious supply problems, and that we're all going to have to change our expectations for, scheduling second doses, and maybe they have to be pushed out. That's just all speculation on my part. The fact pattern is consistent with that. I hope it won't come about, and hopefully I'm misreading the tea leaves on this, but I'm a little concerned about the vaccine supply.
Well, I think that just this whole, over this 11-month period, or 12 almost, but it's been so difficult to predict what's going to happen, and things remain so fluid, and I can't imagine the supply issues that they're dealing with trying to get this out so quickly. But I think, the fact that you're looking at these things and trying to look ahead of what we might anticipate, and hopefully we don't, but if they do happen, that we're ready for them. And I think, the supply issues get back to something that means that every dose that we have is important. And Dr. Jetmore, I know you all have been also part of this process with the vaccine, and I think you've had a good success rate in making sure the doses are being used to their fullest potential that you've had.
Yeah, that's right. We're finishing up our second week of our vaccination clinic at the Elder Bierman building, and it's gone flawlessly. We get allocated by the state 600 doses a week, so we're giving 120 doses a day. And it's gone great. Every day we have extra vaccines, and we're dedicated to the fact of not wasting a single vaccination dose. And those vials, we're using the Moderna vaccine. It comes in a 5 cc vial, and many times you can get 11 doses out of that instead of just 10. We use that 11th dose. That's with the blessing of the CDC, assuming we get a full 11th dose. So we've had a standby list. People have asked me about this. Initially, all of us in the health department put our heads together. Everybody we knew that didn't make the age requirement, which is 70 or above, who had a lot of associated health problems, maybe a history of stroke, heart attack, a history of diabetes or hypertension or overweight. And we would call these people at the end of the day and get them vaccinated. And we also, more recently, have begun putting teachers on that list. And that's been a great thing because everybody wins. The teachers, We're making the teachers safe. We're making it more likely that schools will continue, which is a real need and a real blessing for the community to have these children be able to stay in school. And of course, the teachers benefit. So, yeah, that's been our goal, to get those vaccines out and not waste a single dose. Once we've drawn that up into a syringe, we've got, as well as the vial we've drawn it out of, we've got 6 hours to do something with it. So the people that we put on that list, they have to be able to get there in a half an hour and carry their cell phone with them at all times in case they get that call. So there's no more room on this list. I know viewers are going to say, well, wait a minute, I want on that list. I hopefully will get to the point, Jason, where we don't have to keep a list, where we have so much vaccine that it's just a matter of giving vaccine. We have the capacity of giving 1,000 doses a day in that Elder Behrman Clinic. But just like Dr. Hughes, we're constrained by the amount of vaccine that the state allots us. And so that's where we are at present in terms of vaccination.
Yeah, thanks. And I think it's great that you all are extending some opportunities to the teachers. Obviously, they're on the front lines of, trying to educate our kids every day, but they're exposed to some of these things, and so it's great that you've offered that to them. So I know we're going to pick this conversation back up as far as the vaccine and how available it is and what you can do to get the vaccine, but we're also joined today by a special guest. I'd like to bring Dr. Charlie Nelms into the conversation. It's good to see Charlie. For those of you who don't know Dr. Nelms, Dr. Nelms was the Chancellor Emeritus at Indiana University East, also had many positions with Indiana University, and he's the author of From Cotton Fields to University Leadership, All Eyes on Charlie, a memoir. And Dr. Nelms has done a great deal to help promote getting the vaccine to those. He's been active on social media, and I'd like to bring Dr. Nelms into the conversation. How are you doing?
Hey, I'm fantastic. It's great to see everybody. See all you guys have a beard, even David Jetmore. I haven't seen David in a long time. He's gotten older like me. Yeah.
Charlie, your beard's got a little bit of gray in it, but you still look great, buddy.
I'm hanging in there. Yeah. But I got my COVID vaccination a week ago. On tomorrow, I got it here, and I did it publicly because I wanted to convey to the viewers and to everyone my confidence in the vaccine. And it's one thing to talk about it, but it's another to demonstrate your faith and your confidence in it. And so I did it publicly. Glad that I did. And my wife will be getting hers on tomorrow. So we're excited. And excited for the country, really.
That's terrific. I'm glad you're able to get the vaccine, Dr. Nelms. And I know that you've been active for months talking about how you can have a voice in helping people maybe who have dealt with COVID or who are coping with COVID, and then obviously now have an opportunity to get the vaccine. But I would like to go back a little bit in time. I know that early on you were really putting some information out to help seniors cope, through this. And can you talk a little bit about some of that work that you were doing before we get into a few of the other items?
Oh, absolutely. I'd be happy to. So, I've had a very active senior life, and that's true for many seniors. And when you go from having a very active life to having to stay indoors and all of that, not be able to go to the gym, out to eat, the kinds of things that you've saved up your money to be able to enjoy one day, and you can't do that, then it has a kind of psycho-emotional impact on you. And so I was inclined then to pen my first piece talking about strategies for seniors. And there's some things that we can control, that I can control, and one is my attitude. And so despite all of the things with the virus, I suggest to people that if we maintain an attitude of gratitude for the quality of life and health that we enjoy, that can really make a big difference in terms of how you approach it. And then remaining active physically. So even I can't go to the gym anymore. I walk every day from 60 to 90 minutes at variable paces, at a very variable pace, as well as the incline that I deal with. So those are just a couple of things that people can do. And I recommend that people remain active spiritually, as distinguished from religiously. I mean, some people may choose to do it religiously, but I do a little meditation and contemplation, those kinds of things, and they work for me. They really do work for me. And then, of course, staying intellectually engaged and easy, simple things to do, reading, and if you have access to technology, you don't have to read the entire book. You can read some excerpts from the book. So that combination of things I find to be very helpful for me. And so I was inclined then to share it with other people. And some 10,000 people had a chance to actually view that. So that was good. Yeah.
That's great. Actually, where can they find this information? I'm curious. Obviously, I'm connected with you on LinkedIn and some other social networks, but where can they go to find these messages?
Oh, I'm old now and I do Twitter. If anyone had ever told me 10 years ago I'd be doing Twitter, I'm on Twitter, LinkedIn, and I even have a website. And so just charlienelms.com. And so those articles and some of the links to my Twitter posts and LinkedIn posts are there. But charlienelms.com.
Terrific. I know one of the thanks for putting that up too.
Sure.
I know one of the challenges, Dr. Jetmore, Dr. Huth talked about this, is when we talk about the vaccine, is getting minority groups to come in and actually accept the fact of taking the vaccine and making sure that they get it, especially communities of color. And there are reasons why that's a challenge. And I know that's been some of your conversation lately. Can you talk a little bit about your encouraging words to ask people to come out and make sure that they're getting the vaccine?
So I think the first thing is to say is that it's really important for us to acknowledge the skepticism, as opposed to just trying to pretend that it never occurred and it should not be of concern to people. When we think about the infamous Tuskegee syphilis studies, those occurred in my lifetime. We're not talking about 100 years ago. If you think about the water crisis in Flint, Michigan, that occurred 5 years ago. You think about Henrietta Lacks and the propagation of her cells for research without permission and so on and so forth. So we need to acknowledge the skepticism, okay? The messaging of the anti-vaxxers notwithstanding. I mean, there are reasons for people to be concerned. And so what I say to people, the most important thing is to read for yourself. And thanks to technology, we can access information pretty readily, but we have to be discerning in terms of what it is that we are reading, what we're consuming, and what we choose to believe, because just because it's in print doesn't make it so. And so, so I want to acknowledge the skepticism. But on the other hand, if we read about it, about the vaccine, the side effects, we can read that for ourselves. And in my particular case, I happen to have known Bill and Gail Cook personally, the people who started Cook Medical and then subsequently sold their company to Catalent. And that's the entity in Bloomington that's involved in the production of the Moderna vaccine. But at any rate, if more people would, and Hank Aaron, by the way, died last night, and he was, but I saw Hank Aaron on television just 2 weeks ago being vaccinated, okay? And just think about the kind of impact that public kind of stance on his part probably communicated to a whole host of people, including the president at Howard University, any number of people. But I know individuals who were involved in medical trials. And what I try to encourage, especially Black people, to do is to participate in medical trials. So when various medicines, vaccines or whatever are released, there have been people like you in those medical trials. And I happen to know people who participated in the medical trials, and that's a part of my messaging. that I try to get out to people, that I have the confidence. It is not just a blind confidence, but it's one based on accurate information and actually knowing people who participated in the medical trials. But finally, it's a personal issue for me too. I really do need to say this. And so I've lost a brother 10 years my junior. I've had a nephew who was 21 who was diagnosed, but he survived. I lost an aunt, I've lost a cousin, and a number of close friends. So this is just not some pie in the sky thing. This is real. And so I try to come from that perspective without frightening people. I don't want to frighten people to death in the process of talking about it. But what we don't know, here's what bothersome to me, is what we don't know about the virus and what those long-term effects might be. Death is bad enough, but it may be some things a little worse than that, in terms of what kind of conditions you may find yourself lingering in for years. But with that, I'll stop preaching and then let the real docs do their thing.
Thanks, Charlie. I also want to extend our condolences to you for your loss. I know it's been a rough few months for all of you, and your message is really important. And I don't know, Dr. Huth, Dr. Jetmore, have we seen what kind of conversations have we had with some of the folks in our community about coming out, and has it been a difficult conversation for us here in Wayne County?
Well, there is, I guess, what I would call still a significant amount of, a disconcerting amount of hesitance on various people's parts. And that's not necessarily specific to certain, demographic segments. Like, it's not just Black people, it's not just Hispanic people. I mean, there are people who are involved in healthcare who have concerns about the vaccine, and and hesitance about whether it's the right thing to do for them. But I think I like how Charlie said, we have to kind of acknowledge people's concerns and their hesitance, and not make them feel stupid or belittled on account of it, but to be able to respond to that in a way that's intellectually honest, and acknowledge that there are things about both the virus and the vaccine that at this point we can't say that we know specifically. There's additional study need to be done, even about the vaccines. But on balance, we have to maybe help people through it, kind of walk beside them. I think that's what I hear Charlie saying. We got to walk with people to help them get to the point of being comfortable, as well as leading the way. I've been vaccinated very publicly, on camera. Dr. Jetmore was. We're willing to put our money where our mouths are. And Charlie's done the same thing, and so I think that makes a big statement. And there are a lot of other people around here who are doing that same thing. Martell Winburn and some other folks who are prominent in the community, who are very looked up to by a lot of people. So I think that's a great thing. But Charlie, I wanted to ask you, first of all, when you had your shot, did you have any of the typical side effects that we warn people to expect?
I really didn't. I just had a little stiffness and a little soreness at the injection spot here. But I was encouraged to keep that muscle, keep that arm moving and that kind of thing. And I did that. And I got it on Saturday. And by Sunday night, I didn't feel anything at all. So I haven't had any side effects.
Right. Well, that's maybe one advantage of being a little bit more mature in years. I'm not going to call you old, because you're obviously not old, because that's a state of mind. But the one advantage of being a little bit mature physically is that we seem to have a little bit fewer side effects. Most of the people I know who've had fever and felt poorly for the day after tended to be on the younger side. So that's something I've noticed.
Charlie, I was just going to say it's because of the great shape that you're in.
Yeah, that
just
too.
For the record.
Well, there's no question, Charlie, that all the things you mentioned, I'm sure, you look like you're trim and fit. I'm sure you're eating right. You're making sure that your nutrition is good. You're obviously right there with exercise. All those things are known to have positive impacts on the immune system and really sort of harden you to be able to resist the infection to begin with, not get as severe an infection if you, in all likelihood, if you should come down with it, and you'll have a more robust immune response to the vaccine. So good on you. But I wanted to ask you, Charlie, do you have, are there things in particular, specific concerns, other than the things about, the things that you mentioned, that in some privileged parts of our communities, they've been mistreated in the past. I think we all have to acknowledge that and try to move forward from that. That's not what's happening now. But still, we sometimes hear specific concerns about the vaccine. It causes this or causes that. It causes infertility, some women worry, as an example. But are there things that you hear from the folks that you're in contact with that are specific concerns, and how do you deal with those?
Well, not so much from people I'm around, because I live in a university community, okay? And so people tend to be a little more inclined towards science and understanding it. So less so from the community in which I live, but more so in terms of some of the rumor mill stuff. I mean, even in talking with some of my nieces and nephews and relatives. And so there was this theory floating around early on that Black people could not get COVID. I mean, which is just really ridiculous, but that was floating, that Black folk, have you noticed that Black folk aren't getting COVID? Okay, so that's one theory. Another one is that they are mapping out our bodies, and they're gonna be able to destroy or wipe out a whole, race of people. And I won't call the names of some of those people, but there were those kinds of things floating around. And so while it causes blindness, all kinds of things, okay? So that's why I argue that people need to be more discerning consumers of information generally, but especially health information, because that ignorance or that lack of knowledge could end up being, in many instances, end up being more detrimental than the medication or the treatment itself. And so, but those are some of the things that I certainly have heard. And what I said early on, tongue in cheek, I said, look, if white people get the vaccination, I'm going to get it too. Okay, and so people sort of laughed at me when I said that. I said, but look, if other people if other ethnicities trust it enough in order to avail themselves of it, then I'm going to do it too. Okay, because I don't think others would do damage to themselves intentionally or anything like that. But let me just make one other comment, y'all. What this virus has really driven home, and that is the point around the need to engage in better health education for communities. Good health education, okay? Early on for children in elementary school, all the way up through the university level. Now, I'm not promoting a course on wellness, but I think that we need to give some consideration about how do we tailor messages to populations and to citizens of all ages and ethnicities and socioeconomic levels and all of that, such that we can help people to be better carers for themselves, take better care of themselves.
I love that idea. And as you're talking about that, Charlie, I was kind of imagining, just like you said, not a course in wellness, but there's got to be a way to encapsulate important messages in small bite-sized pieces that are written to the level that people can understand and relate to. And so that's a wonderful idea.
Sure, thank you. Do you all remember Dr. Paul Rhodes? Do any of you, I'm not sure whether you were there.
I remember.
Dave remembers him. He was
Dr.
gone before
Rhodes.
my time.
He was on the medical staff when I started at Reed 40 years ago.
Very good. Well, one of the things he told me 40 years ago, he said, Charlie, he said, the parts of your health, part of it is your DNA determines it. The other part, he said, you can control. He said, you can't do anything about the DNA, but you make sure you control your part, okay? And so what that did for me was reinforce this whole notion around physical activity, emotional wellness, proper nutrition, and all of those kinds of things. And that's one of the messages that I try to pass on to young people who aspire to leadership position, for example, to better take care of themselves. I can control my cholesterol through medication, but there's a predisposition in my family, okay, that I'm not going to escape. The same is true for hypertension. But there are some things we can do, and that's the piece that we need to sort of teach people how to empower themselves to be better caretakers.
Yeah, Dr. Rose was exactly right. You're born with this genetic potential, maybe the genetic potential to live to be 92. But whether or not you reach that genetic potential is up to you. It's not only the things you do, but also the tests you take during your life. Prostate, colon, breast exams, checking your blood for high cholesterol, making sure you're not hypertensive. These are all things that we need to make sure that people become aware of from children onward. One of the real tragedies of this pandemic is the toll it's taken on Black Americans. And so I congratulate you, Charlie, on the part you've done in encouraging Black Americans to get vaccinated and get protected and help achieve that genetic potential that they inherited from their parents, whatever that number is. And I hope for everybody listening, it's something in the 90s. But it's been great to have you on this show, Charlie.
Well, thank you. And I have a spot in my heart that'll always be there for Richmond, Indiana. I lived there twice. That's how much I love the place. I lived there twice, and still am actively involved in the life of IU East through our scholarship program and some of those things. So, and it's good to see you all there. And when you mentioned the Bierman Center site and the Coleman Center and Bierman downtown.
Elder Bierman, Charlie.
Elder Bierman.
Elder Bierman. You probably went there when it was a large department store.
Yes, absolutely. Yeah, absolutely. And the other thing that I want to commend WCTV for, and that is having those children on at the very beginning, encouraging people to wear a mask. I mean, that was a powerful kind of message, even for a senior, mature person like me. That really was, yeah.
Yeah, I saw that welcome come in, and it's great to see those kids and hear that message. And it's just a reminder that, our children seem to get it and understand it in large part, and I think we all need to as well. And also just a message of that you all three have shared about being an active participant in our health and wellness, whether it's getting the vaccine or it's getting the screenings that we all need to get. So, but I know we have some questions. Charlie, I'd really thank you for being here today, and thank you for providing this message. And just a reminder where you can find Charlie. You can find him at charlienelms.com, and he's active on social media, on Twitter, at Charlie Nelms, and you can also find him on LinkedIn. You can hear those messages. They're very important messages. Thank you for the work that you're doing to help make sure that people know that this is just something that they should do.
Thank you very much. And thanks to WCTV and Eric and all of the people there. I remember when it was in its infancy, located over at Richmond High School in a little closet-like. So it's really good to see this. Yeah, thank you.
Yeah, and Charlie, thank you for helping get WCTV started, because that was you are a major part of that. So our thanks go to you for that. And also, Eric wanted to make sure that I told you he said hello today.
Thank you very much. Thank you.
All right, thank you, Dr. Nelms.
Sure.
It's always good to hear from Charlie Nelms. I was telling one of the producers earlier that they needed to keep me on time because I could listen to Charlie for about 2 hours and only think it was about 10 or 15 minutes, just because I love to hear him talk, and he has a great message. Every time I learn something from Charlie Nelms, every time I talk with him. So I do know that we have some questions to get to here in a moment, and just a reminder that folks that are watching, they can submit those questions to Facebook and also on Twitter. But Dr. Huth, I don't know if before we get to that, do you want to go through some of the stats today?
Certainly can.
Okay, great. Let's go ahead and do that, and then we'll get to some of the questions.
I'm sure our friends in the control booth will show this graphic, and we should be used to seeing this now. It's the Wayne County Weekly Lab Positives. Christine's staff very kindly send those to me, and I keep track of those so I can correlate it with the read data. But the last bar on the right is the current week, and I don't know if you guys can zoom in on that a little bit. But so far this week, through yesterday, there were 186 lab positive cases. And Jason, I was saying recently that I realized I had enough data to construct a confidence interval around my projections. So I'm projecting for the week that we're going to wind up about 260 cases, plus or minus 12, so roughly 248 to 272 should be in there at the current rate. And I want to say, with last week's projection, there was a problem with the data. Actually, I will own that, and so I'm 1 for 2, so I'm batting 500 on my projections so far. But if this week holds up, we should be about 260, which will basically help to confirm still a bit of a downtrend, hopefully, in the Wayne County data.
Tom, I'll interject something here. If we fall below 200, we'll drop into the yellow designation for the county, which is fantastic.
Yeah, that
we're at orange, but at level 2.0, and we're one of only 9 counties in Indiana that are below 2.5. Right. So see if you can project that to be below 200.
Hey, you know what? That's just a simple type and a key on a computer. I can handle that for you. That's the second page is death estimates, which is not necessarily a fun topic, but actually there's a silver lining to this cloud. And something I've noticed developing for the last few weeks is that so here's the way to look at this. The bar on the far left is prior to October 1st. For the first 7 months of the pandemic, we had 15 deaths in Wayne County. And then since October 1st, that's 3.5 months, we've had 146. That's almost 10 times. So we've had in 3.5 months 10 times the deaths that we had in 7 months prior. Yet, on just figuring the math on the number of cases that are over age 70 since October the 1st, and the known case fatality rates for those age groups above age 70, we should have had 176 deaths so far, but we've only got 146. So if we were the average of the state, we would have 176 deaths, but we're 30 below that. So that's the silver lining. The deaths are actually lower than what you would project just by doing the simple math on it. So that's the good news.
But I'm curious, what do you account for that?
I think, our
positivity rate's always been less than the states. Like even right now, the state's at 11, we're below 10. So that probably is a fact.
I think there's a lot of things. I think in general, the folks in the county have kind of gotten their game together and are doing better with masking and distancing. I feel like I've seen that. It's not perfect by any means, but it is better in some areas, at least where I go. I don't go to too many places, the grocery store and work, and that's about it, church. But the grocery store is kind of my indicator of how things are going in the county. And we shop at Meijer every Sunday after church, and I feel like the last month or so, the sort of the compliance with masking has been very good there when we were there. The other indicator, Jason, I've referred to this before, is my toilet paper index of concern in the county. And, so when the toilet paper stocks go away, that means people are fearful. And when there's lots of toilet paper, it means people are feeling more comfortable. There's been more toilet paper lately for some reason. So there's that. But the other thing is there has been an evolution in how we're treating and dealing with COVID-19. And I'll tell you one thing that we've done that started in November, late November, was we're giving a lot of infusions of monoclonal antibody, which is a synthetic antibody. It's a passive immunization strategy, and we've done 300 infusions right thereabout so far, and we think that probably avoided around 50 to 60 admissions to hospital and perhaps 5 to 10 deaths, in that time frame. Hard to tell, hard to be very confident in something, in counting something that didn't happen. It's just that if you look at the statistics on what we should have had versus what we did have, this is kind of what we see. And So I think the monoclonal antibody infusions actually is a good thing that is having an impact. And in fact, we're looking at how to get that out to places where it can do even more good, particularly long-term care facilities. And in the last week we've been out and done actually a large number of infusions at one particular facility in the county that was having an outbreak. And then a few days ago we were at another facility and did just a couple of infusions, but we're waiting to see if they get more cases, and we're ready to go back in. That's important because it's hard to get long-term, first of all, as background, just recognize that the burden of the severe disease and deaths is borne in long-term care facilities, hands down. And and so if we just have our infusion center at the hospital, it's hard to get them in. When they have an outbreak, it's hard to get them in there. There's a million reasons why it's difficult, and we can only wind up treating a small fraction of those who qualify. So we're turning that paradigm around. We've put together a strike team and a toolkit with all the resources necessary, and we're trying to engage with long-term care facilities to be able to send them out proactively. And we know that the earlier we can get to them, the better their results. So we've been doing that in the last couple of weeks. And I think that those kinds of strategies, as examples, are having an impact. And maybe vaccination to some degree. We've done now about 6,000 vaccinations just through Reed. And I'm not sure how many through the county health department. So we're probably certainly between 6,500 and 7,000 vaccinations, which would be a tenth of the county. So I think that those things added all together are beginning to have an effect. That's just my speculation. But if you go to the third page of the handout there, and again focus or zoom down onto the right-hand side, Ryan and Stephen, these are the read volumes over time since the beginning of the pandemic. These are average weekly volumes. And really, I guess the one to pay attention to most is the blue bar, which is the total number of patients on or in isolation on average. The last set of bars is the current week. And, it's about the same level that we had at our peak in April, but it feels much more manageable. I guess because we've got systems in place, we kind of know much more about what we're doing, and it feels more manageable, especially having come off a high that was about twice what it is now, just recently. So we're not out of the woods. You can see we still have quite a bit of COVID-19 disease in the hospital, but and we'd like to see it go down further. And I've been preaching that, we're never not going to be in a wave. Even in the summertime where the wave was lower, we had a wave. And what's important is what are we going to do now to kind of harden our systems, prepare ourselves, get to every vulnerable person we possibly can as soon as we can with interventions and vaccinations and education to basically be prepared for the next wave so that we can handle it even more efficiently than we've done in the past.
Yeah. No, that sounds great. I appreciate it. It's just an off comment. The fact that we can have a physician here who has these great bar graphs, but also can bring in the inventory of toilet paper in our community and make that part of the analysis. But
I think Tom does have a toilet paper graph.
I'm going to publish a paper on this.
No, but I appreciate you bringing those out. I do know we have several questions that will probably link into some of the things that you just shared as far as the graph and what's going on at the hospital. So if we could go ahead and bring up our first question that's coming in to us. So it says, I've read where some doctors are saying not to take the anti-inflammatory pain medications for 3 to 4 weeks after receiving the vaccine. They report it could lower the effectiveness. I have a pain pump. Do you think that will have any effect on the vaccine? So a lot of questions about things that might affect the vaccine or vice versa. Either one of you have words of advice for that?
Well, I don't know the exact answer to this, but I would speculate that neither thing would have a very great effect on the effectiveness of the vaccine, either the pain pump or the anti-inflammatory medicine. What do you think, Tom?
Yeah, I mean, I've seen speculation that the non-steroidal anti-inflammatories, things like aspirin, ibuprofen, and then, there are a number of prescription and over-the-counter variations on this, that somehow those people worry that those might affect the immune response. And what I can tell you is I've looked, I can't really find any data on this. If you're worried about it, then use Tylenol, acetaminophen. That's not an anti-inflammatory and will help with side effect symptoms of the vaccination, with the soreness and any low-grade fever or muscle aches that you get.
Terrific. All right, I think we have several questions lined up. So I've heard there are new strands of the virus. Does the vaccine protect you from the other strands? I know that's a big hot topic right now.
Sure it is. And I always like to start with recognizing that there are actually over 5,000 families of variations of this virus. But there have been a few that have been particularly focused on. Everybody can almost name them now: the UK variant, the Brazil variant, the South African variant. Some people think there might be a unique US variant, but probably that's actually the UK variant. People are worried about because those genetic mutations are known to affect the physical conformation, the physical geometry of the spike protein, which is what the vaccines are primed to be able to react to. So in theory, there could be a problem with the vaccine effectiveness consequent to that. But what I can tell you is that all the vaccine makers have been taking a lot of these variations and doing animal-based tests of neutralizing antibody, and have yet to find any that have had a significant reduction in vaccine effectiveness. And I know that Moderna, which is actually a German company, Pfizer and Moderna, BioNTech, this Pfizer-BioNTech. The BioNTech company is a part of that is a German company, and they just published a pre-publication paper actually testing the UK variant, the B.1.1.7 variation that is thought to be now kind of taking over the US version of the illness. They actually specifically tested that in their animal models and found that the vaccine works just as well. So that has not been published yet. It's not been peer-reviewed, so we have to consider those results preliminary. But I think it remains consistent with the messaging that the companies have been putting out there, that they think that their vaccines are still going to be significantly effective. Maybe there will be some maybe reduction in the percentage and so forth, but still, we're starting at a very high level. So if you go from 95 to 80% or something, you're still getting a really good vaccine.
You know, I think it gives you a sense of urgency, though, about getting people vaccinated, because the more people we get vaccinated, the less virus is in circulation and the less opportunity for mutations.
I think it's a very good point. Just another reason to get in there and get it when it's available to you. So the next one is, how long after a positive test can one be vaccinated?
Well, I think implicit in that question is after having acute illness like infection with COVID-19. And really, the only hard and fast rule is that we don't want you to present for vaccination while you're still supposed to be in isolation. You know, you should have gotten past to the point of needing isolation. But after that, you can be vaccinated. Many people mistakenly think that if they've had COVID-19 recently, they need to wait 90 days. That is not the fact. You can choose to, if you want, because you probably have some level of antibodies. But I wouldn't wait, and I don't recommend people wait.
I think where that 90 days comes from is people were told not to get vaccinated if they've had monoclonal antibodies for 90 days. That is
a hard and fast thing. And when I was reading through the updated CDC guidance this morning, I was looking at that section in particular, wondering if they were going to change any wording in that. But basically, there's nothing known about could there be some interaction with the vaccine or not. They just don't know. It needs study between the monoclonal antibody infusion and vaccination. So they do say they want you to wait 90 days after that. But right now, that's a small minority of people who've gotten that. So it's not a consideration for the vast majority of folks.
So someone who tested positive for COVID, they just kind of went through their, 10, 14 days. So say they're 20 days out, it's fine for them to go ahead and get the vaccine. And you would recommend that they do, given especially what we were talking about earlier, if we do start to run into potential issues with getting the vaccine, they may have missed their chance to get it.
Yes.
If they're in some of those groups that have been released.
And that's exactly why I tell people, don't worry about that bit. Just if you have an opportunity to get vaccinated, go do it.
Yeah, terrific. Okay. All right. Our next question. Any idea of how many children are home now due to positive tests?
I knew that number at one time. I don't know currently. I remember at one time it was up to 100, maybe 120 kids that were, most of the children that are out of school are kids that were positive contact. They came into contact with somebody who had COVID, and it's normally outside of school. Schools still continue to be a very safe place for children to be, very low incidence of transmission of the disease. So I can't answer that question exactly. There's always some children out, and it's almost always due to contact rather than actual disease.
But that's in that population, as far as our children, that's really not where we're seeing a lot of the spread. Is that right? I know that was the case at one time where that's not.
No, it is.
It's the older.
No, it is not.
Yeah.
That's one of the things we feared last spring. We thought these children were going to be like little vectors going everywhere and infecting everybody, and that has not proved to be the case.
Right. Yeah. I think we actually have a follow-up question to this. So is it true that children are more susceptible to the new variants?
I'm not aware of that. Have you heard anything on that,
No, not
Tom?
specifically related to children. I think one of the concerns about the variants not only is about vaccine effectiveness, but it's I think there is a consensus that these variants are more transmissible in general, meaning to everybody. Whether that has more susceptibility in certain age groups, I don't think anybody has any idea at this point.
And I think that's one of the reasons a program such as this, and Charlie spoke to it too, trying to get good information out, trying to dispel rumors, and a program like this tries to help to make sure that obviously there are a lot of questions, and the rumor mill is running amok, right, of all the different things, and so I think what they hear from you two today is really important. So, is there another question? Can someone with underlying conditions be put on a waiting list to be called, like teachers? Well, this gets back to what you're talking about, Dr. Jetmore. What's that list look like?
Yeah, well, that list, when we first started, and it's been a short time ago, 2 weeks ago, this is the end of our second 5-day week. We did not want to waste any vaccine, so we put together a group of people who were probably in their late 60s. They were overweight, maybe they had a history of stroke, heart attack, and so that we would not waste the vaccine. And probably half our vaccines have been given to that group of people. When I talk extra vaccine that we've have at the end of the day, which usually varies from 1 to 9 doses. Lately, we've been focused on vaccinating our teachers.
Yeah. I think we have room for one last question. What's the best message for those under 30 who feel they are healthy enough to not need the vaccine? How can I convince people under the age of 30 to get vaccinated?
Well, those people can still transmit the disease. That's one of the things that young people forget. I mean, they may feel invincible, but they may inadvertently be a vector that transmits that virus to a person that's very vulnerable and cause them sickness or, God forbid, even death. So if you're a healthy 30-year-old and you get vaccinated, you're being a good citizen. You're looking out for everybody in society.
Yeah, I mean, that's my constant refrain is, yes, it's true that folks under, under the age of 40 even, they're very unlikely, it's not impossible because it happens, but they're very unlikely to have severe acute effects. We don't really know much about the long-term effects. There's that issue to consider. But really, mainly, it's what can they do to protect the people around them who are vulnerable? Everybody has contact with somebody who's vulnerable in some way, shape, or form, whether that's an older family member or a neighbor or just people you run into at the store. So we have to think about those people, those of us, we young whippersnappers who are less likely to have severe or very symptomatic disease. It's about taking care of others, and that's our duty as community members. That's what we need to do. So that's not just a vaccination. It's about mask wearing and distancing and so forth. So please respect the fact that we are a social creature. That's the nature of our species, and we can transmit it to others who maybe that person's not that susceptible, but they may transmit it to somebody who is. So we have to take that into account. Please consider that.
I think it gets back to wearing a mask, right? Wearing a mask, physical distancing, all these things, they're not only for your health and safety, but they're for the health and safety of people that you care about. And to be responsible as we possibly can, the vaccine's a part of that equation. So as we kind of roll up on time, some reminders about where folks can go and get a test if they're, so Elder Behrman's site, they're still doing testing as well, right?
That's right. We can, you can get testing at the Elder Behrman site from 8 to 6 p.m., 5 days a week. You can also be tested at the Optum site in Cambridge City. And I've got an addendum on the Optum site. Someone asked me if you could get a rapid test at the Optum site. You cannot, but you can get a rapid test if you're symptomatic at the Elder Behrman site.
Okay.
And we also offer testing through Reed. We don't talk about that very much. We're using it more for some special situations like pre-op testing and so forth, but it is available to the public. That's done at our orthopedic center at the the east end of the building. We have a covered area where that's set up to do that. It can be done basically on a self-order basis. For information on anything related to COVID-19 at Reed, just go to Reed's website, reedhealth.org, and at the top there'll be a little banner that says Safe Pathways. Click on that, takes you to everything related to COVID, including how to get tested.
All right, terrific. And of course, those who are able can get the vaccine at the Coleman Center.
The vaccine is at the Kuhlman Center. For the public-facing, we still do some internal Reed vaccination at our MOB clinic, but that's not available to the public now. And but you still register exactly the same way, ourshot.in.gov.
All right, terrific. All right. A lot to take in today. So a lot of changes this week, a lot of information. I'd like to thank Dr. Charlie Nelms for joining us and his message earlier during the program. Of course, I'd like to thank Dr. Huth from Reed Health and Dr. Jetmore from Wayne County Health Department. And again, just encourage everyone out there, ask good questions, try to collect good information. Come back to this program each week to learn about what's going on in our community. And if you do have an opportunity to get the vaccine, please make sure that you go out and take advantage of that, not only for your own health, but for the health of everyone else as well. So again, thank you for being part of the program. Thank you for joining Ask the Doctors, and I hope you have a great weekend.
This episode of Ask the Doctors has been brought to you by Wayne County Government.
Hi, I'm Christine Stinson, the Executive Director of the Wayne County Health Department, and I'm here just to let you know that our COVID Vaccine Center is open and ready to serve you. So however you're receiving your information now, whether it's the radio station, the newspaper, or WCTV, or the Health Department social media page, please stay tuned and stay in touch with them. We'll be posting all of the information that way. Look for the time that we call your target population forward, and the registration links will be provided.